I think that prevention is key to medicine. So I think that's one thing family medicine does really well, because you get that breadth of life. You get to take care of patients when they're kids, and then adults, and then geriatrics. I think you get to teach a lot about prevention. I would love to be able to catch everyone at, 3 days old and then walk them through life and help them, avoid the things that are bad for them. What I really like about being a provider is being able to build that relationship with a patient. You get to be part of some of the life's highest moments. You also get to be part of some of the life's lowest moments, and I think that being there for both of those is important. I think that I've had a lot of patients that have been really low that I have gotten to either witness or be part of their healing journey and kind of get them to a more well place, and that's very, very rewarding, especially when you have that relationship. You could meet someone and, fix their problem, but if you don't really know them, it doesn't mean as much. So I think knowing a lot about a person and their background and building that relationship while you get to help them be better, whether that's physically, emotionally, mentally, or what have you, I think it's really nice. I think the most important part of a relationship between provider and patient is trust, and building that trust together. It's not something that you just get the first time you meet someone. So I think having conversations and talking about patients' goals and where they're coming from is really crucial in setting up that relationship. And then when you can have that relationship full of trust, I think you have a better chance of taking better care of people. I think getting to know where a patient's coming from, whether it's taking care of a sick elderly person at home, or they have 8 kids, or they have no kids, or they're working 80 hours a week. I think all of those play into day-to-day health. And so when you're working on a particular problem, you can treat 8 different people with 8 different versions of hypertension or diabetes, because they have different things going on in their lives that affect that. I think especially with mental health, that's really helpful, but I think it expands beyond mental health, that everything can affect your physical health. If I could prescribe, friendship, if I could prescribe exercise, if I could prescribe good nutrition, those would be my favorite medications.